I'm Dr. Stephen Goldstein. I'm a professor of obstetrics and gynecology here at the New York University School of Medicine and at the NYU Langone Medical Center in New York City. This is another segment in our series, Reducing the Confusion About Gynecology. The topic is sonohysterogram, or what is sometimes referred to as a water sonogram. I wrote the second book ever on vaginal sonography. Vaginal sonography gives us a degree of image magnification that is as if we're doing ultrasound through a low-power microscope. We're seeing things with our ultrasound that you could not see with your naked eye if you could hold it in arm's length and squint at it. For instance, I can see a heartbeat inside a 3-millimeter embryo. You wouldn't be able to see a heartbeat inside a 3-millimeter embryo if you could hold it in your hand. So our vaginal probe ultrasound, vaginal sonograms, give us a degree of image magnification that in my first book I called sonomicroscopy. But sometimes we can't see the lining of the uterus very well. And so we've developed a technique called saline infusion sonohysterogram, or SIS, also sometimes referred to as a water sonogram. Take a tiny little catheter, about the size of a swizzle stick, that goes into the cervix, a couple of inches at tops. You then can inject about a tablespoon worth of sterile saline while you do a sonogram, and that pushes the front and back wall apart and enables us to see the uterine lining with microscopic precision. Why is this important? Because if we now can see well enough to see that there's no real tissue there, patient doesn't need a biopsy or a D&C or any further workup if she's having an abnormality. If, however, we see something that globally involves the entire cavity, well, then we can do a biopsy and it won't matter which wall we would get. And if we see something that's focal, meaning only in one area, like a polyp or a fibroid or just one area that has abnormal tissue, then that patient should have what's called a D&C and hysteroscopy under some anesthesia so that we can be sure to get the area that's involved. So if you've got abnormal bleeding, somebody suggests to you have a biopsy, ask them for a saline infusion sonohysterogram first.